You're left-handed, you said?
Mm-hmm.
Take your hat off, okay?
Yep.
All right. Your left shoulder's definitely more rounded forward than your right. There you go, relax here. You all right?
Mm-hmm.
All right. Abracadabra. I mean, like, there's a big knot right there.
That was really fast. He barely touched you.
Oh, wow. Yeah, that's what we're dealing with in there, brother. Okay, what were you doing when you first felt it, and describe it a little bit for me?
Honestly, I just got out of bed one morning.
Okay.
And maybe it was from the overuse of baseball, maybe lifting and running around and all that. But
And you played baseball for a number of years. You're a pitcher.
yes, sir.
And you hadn't felt that while you were pitching, but maybe had you pitched the previous day? Had you done a lot of working out the day before that you first felt it?
It may have been from that, yes.
So you woke up in the morning and got up, and then you felt it kind of electrical down the leg?
All the way down from my left butt cheek all the way down to my calf.
Okay. And even you said driving here, it's been pretty bad.
Yeah,
It's still pretty bad right now?
When I get out of the car, that's when it's the worst.
Okay. So we have a disc injury. This is where we have the nerve being hit by a disc bulge, disc herniation. This is where an MRI would need to be ordered to evaluate it. My care isn't focused on doing anything to that injured area. My care is focused on moving stress away from it, and that'll give you relief. So it doesn't typically matter to me, from our purposes here today, because I'm not going to touch your lower back. The disc is made about 70-80% water, so you put heat on it, swells the disc, put ice on it, contracts it, so we want to get ice on that. If it was just the muscle, it would be very localized in the muscle. If it was like a pulled hamstring, and usually people understand, we have a deeper connection with our muscles, they have a lot of feeling, so when you pull a hamstring, you go, yeah, it's a pulled hamstring. But when you're dealing with something radiating to that level, it's because the nerve, the sciatic nerve, controls 75% of your leg. So it controls the back side of your thigh, the lateral part, and everything below your knee is sciatic nerve. We have the femoral nerve and the obturator on the upper part of your quad, but that whole channel is one nerve. It's made up of 5 nerve roots, L4 or 5, and 3 sacral. So you have a union making the biggest peripheral nerve in the body, about as big as your thumb.
Okay.
So it's a pretty significant nerve. It's called the sciatic nerve. And the divisions where there's pressure come from the lumbar divisions, because while the sacral foramen are fused, right, that hole can't change in size. So we don't really care about pinching that nerve. Does that make sense? Because biomechanically, you can't make that hole larger or smaller, but the lumbar divisions are based on this disc. So when the disc is bulging, then it starts to actually press or occupy a space that shouldn't be occupied by anything. And now what happens is when you bend forward, I want you to watch the size of that hole. So this is the front part of our body. See how it gets bigger? So this is where, like you're saying, Ed, I sit for a while, I'm okay, but when I try to get up out of a seating position, because when you're seated, the hole is larger. So you're in what we call antalgia. You're opening up the hole the nerve goes through. Then when you go to stand up, the hole gets smaller, and that's when you pinch the nerve. Does that make sense? So it's what we call a mechanical pain. It changes based on your mechanics. You're in the right arena. I'm gonna help you today. That's what we need to be. A non-mechanical pain would be, Ed, it doesn't change. Nothing seems to change it. It's just constant. I can be upside down. I can be laying down. No position changes it. That would be something a little bit out of my arena. Maybe something else is going on, a tumor, a lesion, something like that in your spinal cord. But when you're dealing with mechanical, hey, it hurts here, feels better here. If you tilt, you lean, your body finds a comfortable position because you're changing the size of these holes. It wasn't 2-3 years of baseball that caused that. It's finally what brought it to the cliff edge and made us the straw that broke the camel's back. But so today's care is centered around, I suspect that if this is overworked down here, another part of your back must be underworking to allow that to happen. You can't have an abused area without having an underworked area. Remember how I was saying earlier about the nerve's taser muscles? So that tightness you're feeling is because of the irritation of the nerve sending an electrical signal to a muscle. Muscles never ask the question, where did this signal come from? It just says, I received a signal to contract, I'm going to contract. Generally, the brain sends the signal, but when you're dealing with a disc injury, that disc is causing a wrong aberrant signal to be sent to the muscle. And so you can't fix that by just rubbing the muscle. The muscle's being tasered. Be like me shooting with a taser gun and going, just try to relax, and you're, right? That's silly. We have to stop the tasering first. So as quickly as possible, we'll get you laying down, get the weight off that disc. We're gonna ice it, move the stress away from it, and we'll get you taken care of here. But just look straight forward, and we'll get you real quick. Just relax your back, just relax, look straight forward. All right, I'm just gonna look at your posture. Your head's about an inch forward. Look at these shoulders. You're left-handed, you said?
Mm-hmm.
Take your hat off, okay?
Yep.
All right, yeah, your left shoulder's definitely more rounded forward than your right. All right. Yeah, about a half inch. Your left shoulder's more rounded forward. Just gonna see the hips. Your whole torso is going over to your right. It's the left leg. Yeah, your torso's trying to shift. Left hip is high. Your body's trying to move things around to find relief. Perfect, just like that. Deep breath in, exhale. Head back. Yeah, there's the problem. Deep breath in, exhale. Let it go, let it go. You get the idea? Right? See what I'm saying? We have no movement from about 8 vertebrae up there. They basically stuck their tongue at me. Don't let anybody put their hand on your lower back. If anybody puts their hand on your lower back, just say, this guy in Sarasota said that my pain was coming from a disc injury. Should we manipulate the areas where the discs are injured? The goal is to adjust the areas above and below to move stress off that area, okay?
Okay.
This is the SI joint down here, but just in case nobody goes in here and starts pushing hard on your lower back, I'm gonna try to loosen up your SI joint without upsetting your lower back. I just wanna see how you're doing here. Deep breath in. Is there a lot of pain here twisting? Is that discomfort? You okay?
That's fine.
All right, breathe. I got you, not gonna fall. Exhale. All right, it's okay, let's say for me. Your ability to throw a baseball, part of it is like golf,
Mobility.
range of motion. And your rotation here at 24, I expect a lot more from you. I know you're a powerful guy, I know you're muscular, but you've lost a lot of ability to rotate. Does that make any sense? And so you can show me how to pitch all that, but the biomechanics of rotating, deep breath in. A lot of resistance here. All right, face up for me. If you take your hand and stick it into a wound, it's going to hurt. Surprise, you don't need to be a doctor to know that. You have a wound. You have a disc injury wound in your lower back. Surprise, it isn't beneficial to jab your finger into it. We're going to try to take stress off the wound, butterfly stitch, close the wound, right, and leave it alone. Any headaches?
No, sir.
Oh, no headaches, okay. I just asked that because I got a lot of asymmetry here in your neck, I imagine, comes from pitching. Usually when the bones are asymmetrical, the muscles are working real hard.
Mm-hmm.
When the muscles work real hard, there's a lot of lactic acid buildup. That can cause tension headaches, cervicogenic headaches, come from muscle tension, from posture, and from biomechanics. Very gentle, I got you. But let your chin go up a little bit. There you go. There you go. Relax here. You all right?
Mm-hmm.
All right. As a patient, it's sometimes hard to describe how you were adjusted. I don't know, the guy grabbed my neck and rotated it, right? But there's a difference between up here and down here. Does that make sense?
She was up high.
Good.
She definitely didn't rub, though.
Okay.
She didn't loosen anything. She was getting me in and out. It probably took her 5 to 8 minutes.
Okay. That's good. I'm glad that she was targeting your upper neck. We're going to go a lot deeper than what even that is, but I'm trying to get an assessment also for what's moving cold. So I didn't massage you first because I want to see how much of your back is working. It shouldn't require a 20-minute massage to get your bones working.
No.
Now, if it isn't working, now we're going to go in and massage it, and then we're going to try to adjust it again. But we're examining and treating today. I'm assessing your back, and I think my upper back might move if you massage it first. Perhaps it would have, but it's telling to me as the cause of your symptom how it didn't move cold. You understand? I tried to start the engine. It hadn't been warmed up, and it runs different when it's warmed up versus when it's cold. There you go. There. Yeah. A little tight there, but yeah. Chin up for me. There we go. Yeah, left side a lot tighter. Okay. Your alignment and your mobility, the posture of your spine is what's supposed to give you your strength. There's supposed to be a curve in your neck, and your neck has a lot of resistance to arching. Going back this way, does that make sense?
Mm-hmm.
Your neck belongs curved. So everything I do on the table is a preamble to make your spine supple enough to be able to be curved. many things in life, school and work and loading a dishwasher, everything is looking down.
Mm-hmm.
And that predominance of looking down, we stretch the curve out of our neck. That creates mechanical imbalances. And then and I told you it's my leg and why you work so much in neck? Because the more forward your head goes, the more tight your middle back becomes, the more overworked your lower back is. So it's a domino effect that ultimately, if we can't get your head over your shoulders, we can't ultimately fix your lower back. Does that make sense?
Mm-hmm.
So they're not separate problems. The upper neck is the boss of your whole spine. If the upper neck is not on correctly, then the lower back is going to be under extra stress. That. Feel it?
Mm-hmm.
Yeah, right. There. You've got it buried. There we go. We'll see it in a second. The Asian medicine, Eastern medicine figured out a long time ago that we can comb the tissue and draw out the acidity and the inflammation that gets trapped in these tight areas. They call it gua sha, is that combing. And when you do it, you'll see like a little bit of a mark directly over the area, what I can feel, and also where you feel soreness. They all sort of directly correlate with each other.
Is that almost like scraping?
Yes, yeah. The grastin or the fascia blasting, but yeah, right here. There's going to be a mark right on that.
I can feel it.
Yeah.
It's tight.
Let it relax. There you go. There you go. I don't suspect this feels like very natural.
Not
Your
at
neck,
all.
right, your neck is not. If this felt natural, again, I'd be confused, right? If the normal position felt normal, then you wouldn't have that, ultimately even sciatica at your young age. Something has accelerated this. I understand you've been physically active. I understand you probably work out a lot. Those things accelerate the aging process. If you only have a small percentage of your back working, then when you go exercise, that skeleton crew does all the stress. Does that make sense? Or receives all the stress. Okay. There we go. Is your wife into sports? Does she play? Or?
She did. She plays tennis
Okay.
for a long time, and then she stopped maybe a year ago.
Okay.
She was actually going to come with me, but she got in a car accident, so
Oh, no, I'm sorry.
she had to go through the insurance purposes and whatnot, and
Gotcha.
she may have
Oh, gotcha.
some therapy that she has to go to.
Gotcha.
So that was that recent then?
Mm-hmm.
Oh,
I'm sorry. That's scary.
Right. There's where the. That's a lymph node there, right? Yeah, these are lymph nodes. Everyone was wondering what the bump was. These are part of your immune system that gets clogged by the tightness in your neck. So those are the kind of the sewer pipes, the drain pipes that drain your neck, drain your sinuses, your face. They all drain down the neck. And you're saying that getting my neck worked on can help my sinuses flow better? Yes, that's what I'm saying by having this clogged in here.
I'll take it.
Yep. There you go. It's okay. There you go. Good. Kind of like a drawer. It closed 80% the first adjustment, and that was the final 20%. Same bone, but just an extra movement out of it. There we go. This side definitely was not as loose. Come on. Oh, I'm done, Miss Grady. Oh, right there. Okay. All right. 1 second. Also, I'll check out that shoulder at the end, but let me see here. Yeah, that's right here. If I put a marble on his back, Carl, I'm not sure if you can see that from where you are. Can you see that, Carl? Hard to see. This is about a 1/4 inch higher right here compared to here. Real tight. So the left middle part of your back is the tightest part. That causes a left lower abuse, left sciatica. The cause is up here on the right in the middle. There has to be an underworked area to allow for an abused area, and the right middle is your tightest, causing a milder left middle tightness, causing a left lower abuse. But the cause is right here. And this is where when you're sitting, we're going to show you how to get some support right in here. And this will keep the stress diverted away from your lower back while the disc calms down. It stops getting so inflamed. And yeah, it's right here. There it is. How would you describe it? I'm just curious if you can.
It definitely feels tight and inflamed right there.
Yeah. Okay.
I could feel the difference from when you
Left,
went down this
yeah.
side and the other side.
Yep. Yep. Okay. See, I'm not just making this stuff. You're just making it. No, it's obvious. This is about as obvious as it gets. The right side is elevated. Right there. Sometimes when I press here, it's not atypical for you to feel it in your leg as we go right into there. Sometimes some patients will tell me, I feel that in my knee right there. Kind of idea. This is where the nerves begin in here. And then the foundation for this ultimately came from my father, who, when I was a teenager, I would work on my dad's sciatica by working on him up here. And he had gone through myriads of treatments focused on the areas that were injured, and it just made him worse until he sort of figured out, leave the injured area alone and work around it, above, below, to the side. If you have a sprained ankle, it's never beneficial to go in there and sprain the ankle more. It's already hypermobilized. It's already sprained. What are you going to do about it? Just leave it alone. Stop poking it. Move the stress away from it, and it can heal. Have you heard the word lordosis before?
Mm-mm.
No? It's sad to me. Or the word curvy. The medical world is lordosis, but your back doesn't belong ortho, so there's supposed to be an arch down here. And without that arch, without that lordosis, disc injury is an inevitability. It will happen when the curve goes straight. This starts at a young age in America, sitting in school. I have 14-year-olds sitting 16 hours a day. It's just the over an abundance of sitting that causes this. It's just going to be me rubbing this for a little bit. It's really knotted here. It's really tangled. He's got it all bound right there. Gee whiz. That's the whole reason why the left lower is overstressed. Wow, a lot of resistance up here. How old were you when you first started playing baseball?
5.
5? Cool. Yeah, I did 4 or 5 years. I just did Little League, and then they called them minors and majors or whatever. And then I had a lot of heart, but I was no good at it. But I don't know. There's something. I'm impressed when somebody can hit, fastball. How it shouldn't be possible, right? The thing is, it's the reaction time required and the. I'm sure you could teach me. It's all about the arm angle and your hand position on the ball, and
It's the hardest thing to do in sports.
right. It's just ridiculous to me.
It all comes from their lower body.
Uh-huh.
Being able to fire your hips and make
Huh.
everything like a rubber band feeling.
Uh-huh. And then, and then how a pitch halfway in its arrival to home plate, all of a sudden can just change its trajectory. Like it's like a clown game or something. Doo-doo. Like the string just pulled the ball, or it's just crazy. So then it's a mental game of like, okay, guessing what's going to be thrown. And
That's one of my theories. They don't guess. They sit on one pitch and at bat because you can't cover the whole plate.
okay, so you just hope that what you want is going to happen.
Mm-hmm.
Gotcha.
And they're so good that they just don't miss it anymore.
Gotcha. Okay. So they sit on that one pitch,
Mm-hmm.
and then when you throw it, they got it.
Mm-hmm.
Got it.
If you don't throw it, they're probably gonna get out.
Gotcha. All right. Wow, like a rock. So all of my athletes I put into a category. If you're going to be an athlete, you have to have a car mechanic. If you go off-roading with your vehicle, you have to go see your car mechanic more often than a person that drives on smooth roads.
Mm-hmm.
Just you're putting more stress on your back and body. You need to make it's more important than ever that your whole spine is working as a team and that no one area is being overworked. That's really what predates that, and what allowed that to happen was this all up this from here. Really, this whole section has been way too tight, and your lower back's been left holding the bill and doing all the mechanics. This guy's okay up here? How pretty sore a little bit, but not too bad.
Not too bad at all.
This is a rotator cuff. This is your lefty, you said?
Mm-hmm.
This is what, 99% of rotator cuff tears are supraspinatus, yeah,
Mm-hmm.
is this guy. It's because the muscle belly is really only about 1 inch, 2 inches long. The more forward your shoulder goes, the more taut the cable becomes and the easier it is to tear your rotator cuff. So in essence, you're set up for it. Keeping your shoulder back when you're not pitching makes it so that you don't just, constantly stress out that tendon. The crunching that you're hearing in your left shoulder has more to do with the tendons being tight, and then when you move your shoulder around, all those tendons are being plucked,
Mm-hmm.
like cables. The tension of the cables comes from the posture, and the more forwardly rotated your shoulder becomes. Part of it is that you have injuries back here that have been avoided. That's what draws your shoulder forward. So making your back not need to be avoided, getting the soreness out of your upper back, allows us to retract your shoulder back. And again, this is healthcare. How do I prevent, rotator cuff tears? Well, you got to fix the alignment. You can't just stay in this alignment and think, it won't make it all the way. Yeah, notice a little bit more difficult, right? Getting your left arm back.
This one's always a pain.
But you see the difference, Right, look how loose that was.
Yeah, I know.
When I bring your left arm back, it's like, whee! Your left arm, it's like you barely can get it up on there. Come on! The amount of effort to even get his arm on his back, your shoulder doesn't want to, go back. You have to clear all this out. He's going to come out quick. That was like one swipe. Abracadabra. There's a big knot right there.
It was really fast. He barely touched you. So that
there's
just
not.
is that showing why he has sciatica then? is that?
This is all bound up here, causing a left lower abuse. He's the tightest up here. It's frozen. The mark is the evidence of the restriction. The tightness, if it wasn't so tight, it'd be flowing internally better. So because it's so been mechanically tight in your middle back, this area is congested. There'll be some over here, but I would say maybe like half. The left is not exempt. It's definitely participating. Both sides of his middle back are tight. This is just 2-3 times tighter than this. Both are causing extra lower back stress.
The closest thing I've had to this is scraping,
Okay, okay,
but it definitely feels a little different.
okay.
Is that like the grass stone scraping, you think?
Do you remember what they called it? Was it like fascia blasting, or they called it just scraping? Is that-
I think it was fascia blasting.
Uh-huh,
They would
okay.
take it was like a curved stainless steel
Might have been Graston.
tool,
Yeah.
and they would scrape only muscle.
Okay. Yeah.
Because if you scrape the bone, it didn't feel very good.
Yeah. You definitely. Nor is it effective or beneficial, right? But yeah, the way the spinous is, you just sort of. This is all just congested in here. This is all. All of this here makes it harder for him to retract his scapula back into it. So this is in the way, and so his scapula can't. He keeps running into this. Ribs out of position, muscles all spasmed and tight. It's harder for you to get your shoulder back. 24 vertebrae in the spinal column, 5 encounter 99% of surgery. Nobody talks about it. You know, if there's only 5 that have surgery and 19 statistically never have surgery, this is not from chiropractors, this is from medical doctors. Where's the conversation of why? And it's not age then, because all of the bones are the same age, all of the discs are the same age. It has to do with the mechanics, your posture. The teeth that you don't chew on don't wear out. The football players that spend their entire season on the bench never get concussion. It's only the ones that are in the game playing are the ones that get injured.
Should I expect to not be able to move around today or tomorrow?
You'll feel great this afternoon. Tomorrow morning is going to feel like you went to the gym and did a big workout. So these areas are going to be sore in a very similar way to a muscular soreness when you do a big gym workout if you haven't been to the gym.
Okay.
It shouldn't be anything outside of what you've dealt with. I doubt anything will. It should not overwhelm you, but you're definitely going to be aware that you saw me today.
Okay.
If you went to the gym and did a big workout and you're not sore the next day, there's only 2 reasons. You're either already in phenomenal shape, right?
Do enough.
Or the care wasn't intense enough, right?
Mhm.
The workout wasn't intense enough to push you. Right there, I could feel it. Right there is infraspinatus. So supra means above, infra means below, spine of the scapula, right? So there's 2 muscles, 4 rotator cuff muscles. These are the 2 kind of primary ones. Okay. I always think of the Toyota Supra, Supra.
We actually lost 3 guys in one season to slap tears
Right.
in their rotator cuff.
Yep. Well, this is what I'm saying. Leaving this as tight as it is, you understand? It's not far off into your future.
It's not ideal.
It's not ideal that you're leaving that tight. This is nice and see how soft it is over here.
Mm-hmm.
That's what it's supposed to feel like. Nice and soft. It shouldn't feel like a band. You know, that's just muscular band. Just that needs to be checked every once in a while.
That's right where it is.
Yes, sir. Yep. This is all. You gotta loosen up this joint right in here. Let it go. Breathe. Let it go. Come on. Right there. Breathe, breathe. Wow.
I promise I'm not trying to
It's
block
okay.
it.
It's okay. It's okay.
It's hard to
A
breathe.
lot of tension in here. you this side's actually more locked. This right one, this is what's causing left abuse. It's not just the right middle back, it's going to also be the right hip. Right here.
My hips are terrible.
Well,
I couldn't do a full squat until my senior year.
well, you know, you gotta have Dr. Ed in your life. Yes. You gotta have.
And they called me half squat for 2 years.
Oh, jeez.
I told them I was going as low as I could. They didn't believe me though.
Is that your coaches too?
Mm-hmm.
Wow.
And the only way I was able to get down all the way by
Mhm.
putting more weight on.
Wow.
The heavier weight would be able to push me down, but
Jeez.
when we did our warm-up sets,
Right.
I had no control of going all the way down.
Wow. Hence also why we have disc injury. You know, even with the best form, when you're squatting, your thigh's coming closer to your chest, so this curve is going straighter. Does that make sense? So I understand you're looking for power. I'm just saying we have to be careful and know that all the parts of your back are working. Otherwise, doing an activity with just your lower back has a high chance of further injuring it.
Mm-hmm.
Right? So it's... I'm sorry.
I'm definitely not lifting the way I used to.
I understand.
I stay around 245 and
Okay.
lower.
Right above the waistline on your left side, that's where the disc is injured. We want to ice about the size of a quarter, maybe $50 size icing right here. Don't be standing in the hot shower for prolonged times, letting this get heat on this. Take a hot shower, let the water hit the sides of you, but don't have a long period of time where heat is hitting this. And in a minute, we'll show you how when you're sitting, we're going to have pressure up here. And you'll feel a lot better when you go to get out of your car because having the pressure up here keeps your middle back engaged while you're seated so that when you stand up, this area hasn't been doing the work for the hour drive. And this area's been participating, and so it's not going to be, so threatening to your lower back. Stretching your shoulders back at the end of the day. So the piece of foam I'm going to show you that you're going to use when you're seated is called a Deneroll, and it gets pressure in your middle back. While you're on that, ideally on the floor, you're also going to have your arms above your head, all these different angles you're going to work. It's very similar to brushing your teeth. You want to end the day putting your spine in the right position.
I gotta stop sleeping on my stomach too.
Yeah, bad boy, handle with it.
I'm trying to break it.
All right, well, part of that is that your back has all that inflammation in it. That's why you're trying to get away from it. I don't blame you. Nobody wants to be in a room that's filthy. Broken TVs and there's glass.
Mhm.
Once we tidy up and remodel the room, you won't need to avoid it. Your stomach sleeping most likely is an avoidance. So as there's no reason for something to be avoided, it's comfortable to be there. There are injuries and things that have happened to us that make us go into avoidance. Yeah, you can't be playing with all this acidity in here. The acid actually attracts calcium. So acid is negatively charged, calcium is positive. That's where you get bone spurs.
You normally get those in the elbow, don't you?
Well, anywhere that you leave acid, you can get them in the muscle. You actually can get bone being laid down in a muscle if there's so much acidity. And then I wanted to see how right in here. You want to make sure that's not sore.
Not at all.
Good. You want to. If that ever becomes sore, you got to be careful pitching.
Mm-hmm.
You got to. It doesn't self-resolve. It's called medial epicondylitis. You want to check and mash that down. Then you have lateral. How's this guy? How bad? Nothing.
Not
Good.
at all.
Beautiful. Perfect. That's what you want.
Oh, wow.
Yeah, that's what we're dealing with in there, brother. But, notice, you see here at the bottom, that right lower, so your head's up here, that's your right lower, that's the cause.
Okay.
So we have a right restriction, a left abuse, and this picture doesn't show the unlevelness of your back either. This is this is a quarter inch higher on that side. If I put a marble, it's all going to roll to your left, but that's where we're going to show you in a minute how to get some pressure in there. Once you go, let's go back face down for me. Come on, brother. Good, there we go, got a little bit. Come on. All right, breathe. There's a little fly on my back. Yeah, it's me. There it is. There we go. Go ahead and tilt your head to the right for me, bud. Tilt your head right, tilt right. It's okay, right in there. Tilt your head right. Nope, nothing there. Straight. And your neck's all tilt left. No, no, no. There we go. Tilt to your left. Nothing, okay. 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 That's all I got. Okay. Okay, big toe. There we go. Okay. Just greedy. Being greedy. Okay. Making sure I get to it. Okay. All right. Come on. Come on. Come on. All right. Knees bent. All right. Now it should be pretty uncomfortable where it's pressing here. You understand? And that's okay. If it's just upset where it's pressing, hang in there, breathe through it. If your lower back is getting worse, or if the leg is getting worse, you need to let me know and we need to move higher on your back. Okay? That can happen, and this is why we have to be careful. It's why I don't just get on television and sell dental rolls, because they can hurt you if we stretch and your injured area is doing the movement. We're trying to make the middle back move. It's resistant to moving, and so there's a higher likelihood at the beginning of your care that where I want you to move doesn't move, but where it's injured it moves. Does that make sense?
Mm-hmm.
So you gotta be careful, but just try to bring your arms up. Let's see here. Arms up, bring the other arm up. Come on, left shoulder. See
Yeah.
you see my point about your left shoulder being rounded forward? Your right arm lays flat like nothing.
It strains. The strain to get it there.
You gotta work it. No, I don't mind if you understand? This is a journey. This is not a race. Okay? This is a rally, not a race. This is stretching. This is time. I don't need to give you something so difficult that I overwhelm you and you get off crying, dying. We need to learn how to brush your own teeth, how to take care of your spine. It involves beginning. Nobody's ever shown you how to arch back like this, I imagine, right? Okay.
No.
All right. So didn't even know what lordosis was, let alone that it's valuable, let alone how to restore it. We have to mold and stretch your back into the position that your body used to be in when you were young, that we lost, and now we're just bringing it back to fruition. If you cut your skin, I'm going to say close the wound and leave it alone. Does that make sense?
Mm-hmm.
Stop whacking it. Every time you do a sit-up, every time you get out of a car for an hour without support, you're poking the wound. And yeah, it's going to hurt. The wounds don't like being poked.
Mm-hmm.
So we have to, instead of putting the pressure point here, we're going to move the pressure point to where it's not injured, and then the area that's injured is going to say, hey, thank you for moving the stress to another area that isn't injured. And the curve being in your back all the time maintains that stress off your lower back. It's not like one piece is causing all your symptoms. I've taken too many x-rays and MRIs where I've seen disc injury in a person that has no symptoms. And how would I explain that? The medical world only takes pictures of people that are in pain, right? I've taken pictures of people with no pain because I want to see how their spine looks. You follow me? And I've seen some terrible looking x-rays and MRIs in people with no pain. And I think that data isn't there. The medical and chiropractic world generally only takes pictures of people that have symptoms, right? So they think that whatever's on the picture is the justification for their symptom, right? But I'm trying to say that there's other components to pain than just what's measurable and quantifiable on a blood test or an image. And that's the soft tissue, that bruising, that soreness, that you can feel it. Like, yeah, there's a lump there, but that's not measurable on MRI, right? But it's at least a third to half the reason why your symptoms are here. Anywhere from all the way up here, but really, right in here. Get the idea?
Mm-hmm.
You're gonna have pressure for the next month. I don't want you sitting without something behind your back.
Okay.
Okay? You need support, a reminder for your back to be arched.